The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. We're talking about vibrant womanhood. And today, with me on the show is Dr. Sheridan Fernandez. Welcome, Dr. Sheridan.
Thank you.
Your host today is Amy Wellard from the Wildwood Lifestyle Center. And we're going to be talking about a condition that is not a life-threatening condition, but can cause a lot of pain and discomfort, and that's fibroids. Dr. Sheridan, I understand that up to 80% of women aged between 30 and 50 are actually suffering from fibroids.
It's a common thing.
And it's very common in Black Caribbeans,
Yes.
more than any other racial group. What exactly are fibroids?
Well, first of all, there's good news. It is a benign tumor. Okay? Fibroids are very, very common, the most common pelvic tumor, but they are benign. They hardly invade the surrounding tissues. They don't invade the surrounding tissues and do not cause death, directly cause death. But if you were in menopause and you already had a fibroid that wasn't operated on, let's say you didn't have it operated on, or you didn't know you had it, but you had the fibroid when you went into menopause. As you go older, as in 60, 70 years old, there's a 0.03 to 0.05 to 7.07 chance that you can develop malignancy from the existing fibroid.
So what you're saying is it's a very, very low risk.
Very low risk.
Okay.
Yes.
So what is the cause of these fibroids?
Okay, fibroids are benign tumors of the smooth muscles. You can find smooth muscles all over your body, your blood vessels, the lining of your esophagus, the lining of your gut. But the biggest bunch of smooth muscles you could probably say is in your uterus. Okay, and there are a lot of receptors to estrogen in your uterus, and it is genetic, you know, whether you have a lot of receptors or your receptors are very receptive, receptors are receptive, or sensitive, you would say. It is genetic. This propensity is genetic. And so if you have an increased level of estrogen and you have the genetic propensity, you would develop the tumors of the smooth muscles.
So would that indicate that ladies that have never had babies are at a greater risk of fibroids because they tend to have a higher level of estrogen?
Yes, it is a uterus that has been deprived of a baby will console itself in a fibroid. I'm sorry to say that, but it is true. It's because they have all these high levels of estrogen, never resting, you know, always having the estrogen.
But on the other hand, it's a blessing for the women that have
For
had
the
lots of
ovaries.
children.
Yes.
The more children you've had, the less likely you are to have fibroids.
Yes, it's true. More children, less fibroid.
Okay, so what are the other reasons a person could possibly be at greater risk for having fibroids?
Okay. When you're not pregnant, you develop fibroids. It's stress. It's not stress, sorry. Your hormones are high, so then you develop. There's a risk between not getting pregnant and having fibroids. But when you finally get yourself pregnant, if ever you have this propensity to develop a fibroid, this fibroid will grow fast, really fast. You know, change in hormones also can make fibroids grow along with pregnancy.
Okay, so it's possible to be pregnant and have
Yes.
a fibroid.
And you would have a difficulty, like when I had a patient with fibroids, where is the uterus here, you see? Because you feel something that's different from the uterus you don't know. You might have a uterus of 3 months, but a baby of 3 months, but your uterus is 5 months, you know, because of the mass. And she suddenly has pain from necrosis of the fibroid because the blood supply cannot supply the fibroid.
Is that life-threatening for the baby?
It could be life-threatening for both the baby and the mother.
So So if a lady in pregnancy does experience sudden abdominal pain that doesn't feel like perhaps the normal stretching of the uterus, what should she do?
She should seek consult right away, because it could mean the loss of the baby and or even her life, if it were that thing. But of course, any pain in pregnancy, you have to go seek consult. It's not normal to have this pain in pregnancy.
Now, I heard there was a connection between oral contraceptives and fibroid risk.
Yeah, especially oral contraceptives that are high in estrogen. You know, there are different kinds. You have high dose, medium dose, and low dose. It's the high dose oral contraceptives that are very, very closely linked with the development of estrogen, of fibroids, I'm sorry.
And would that also correlate to ladies that are overweight? They would have a greater tendency to be getting fibroids?
Yes, also because, again, if you're overweight, your fat produces endogenous estrogen. The fat produces more estrogen, so then you make yourself prone to developing fibroids.
And what other factors in our lifestyle can make us more likely to get them, besides the weight, the excess weight?
Stress can make you prone to developing fibroids, as it makes you anovulatory. Hypertension is associated with the production or the development. Even hypertension is associated with the formation or the development of fibroids. And of course, bad nutrition. So all these things.
So how would I know if I have a fibroid? Can I be without symptoms for a long time?
Majority of patients with fibroid have no manifestations. Well, I had a patient who came to me like she's full-term pregnancy, and she didn't know she was pregnant because she was rather of the big size, and they thought that she was just becoming fatter and overweight, gaining more fat around the abdominal area. But really, it was a fibroid as big as a 5-gallon bucket. You see these paint buckets, these 5-gallon ones. Her fibroid was even bigger than that. It could not enter the 5-gallon.
Amazing.
bucket.
And she was pregnant at the same time?
No, no. She didn't know she had it. She was asymptomatic. So majority of fibroids have no manifestations.
Right. So often the doctor will discover it when doing an ultrasound for a baby.
Yeah, probably so.
Okay, but some ladies are experiencing bleeding, and is that because of the situation of the fibroid, exactly where it is in the uterus, it can cause bleeding?
Yes, the most common manifestation probably that would alarm a lady would be bleeding. And we are afraid to be bleeding beyond what we bleed regularly, and that's about a third of cases they bleed, and it's something that sometimes ladies would have to have blood transfusions. And it is a specific type of fibroid that locates itself in the lining of the uterus, so that it affects the lining. So when you have menses, the fibroid is there and you bleed more profusely. So then a lot of women may even have their uterus taken out, even with a fibroid as big as a marble. Depending on where it is located, you might bleed profusely.
And obviously if you're bleeding in between menses, then that indicates that there is something going on. So we do encourage you, if you're experiencing those symptoms at all, do go and see your physician and find out what that is. Because any kind of menstruating-like bleeding in between the period, it does indicate the need to see a physician.
Yeah.
So how does fibroids affect our chances of conceiving? If I want to conceive a baby and I have fibroids, could it possibly limit my chances?
Yes, because if it were inside and if it were inside the uterus, you see how the sperm has to swim past it. Sometimes it really blocks the passage of sperm, or sometimes it grabs or it supplants the implantation site of blood supply, and causing inflammation around the area of implantation, so that you may even have a fertilization. You might have a viable fertilized egg, but it cannot implant itself because there's something there that's causing problems. So that's one thing. that it could do. That's the way it works
Okay.
to make infertility come about.
So what's the best thing to do to treat fibroids once we know that they're there? And very often the doctor won't know it's there until you're
Yeah.
several months into pregnancy. Will the doctor try to treat the fibroid while the lady's pregnant?
Yeah, while she's pregnant?
Yes.
If it doesn't cause any problem, the doctor will not touch the fibroid. But if the fibroid is necrotic already, it's dead inside, you know, and it will cause toxic problems with your patient, they may even opt to take the fibroid out, because then you would not only lose your baby, but you would even lose your mom. So you just have to run the risk of which is more important. But of course we want to keep the baby. I've done that, you know. When I had a really necrotic, you could tell by ultrasound that your fibroid is going into necrosis, and how much necrosis there is by sonography. I really had to take the thing out, but the Lord is gracious. You ask for His help when you do this. Even to make the decisions, you have to ask Him to help you. I decided anyway, and I took this out. We were able to keep the baby, and the mom was okay. Of course, we delivered by C-section because we had made a big scar on the uterus.
But both the mother and the baby were well, and that's the main
yes,
thing.
praise the Lord. Yes, it's not an easy task to do that. It's not really that easy.
So if she's not pregnant and she's got fibroids, what treatment would you recommend if we're going to look at natural approaches?
Okay, well, many times they have pain. You have to take into consideration that your patient has pain. You treat and help support and her with symptomatic and supportive therapy for the pain, you know, so that she's able to deal with this. But taking care of the symptoms and the signs will not really, and support your lady would not let this disappear. Okay, but I can tell you my specific experience with fibroids. I had several fibroids, but the size of less than around 2-3 centimeters, 3 of them. And I can tell you, this is funny. It's not funny, but it's funny. Oh, you know what I mean. When I would eat properly, meaning I would deliberately become a vegetarian, and I would juice myself morning and lunch, I would be able to shrink my fibroids. I'm not telling this to just pull your leg, Amy. I did scans on it. I proved, yes, before and after. So then it disappeared the first time. I thought then, okay, I'm fine. I don't have the fibroids anymore. And so I went back and ate my chicken, my cheese, and my whatever, you know. I enjoyed myself. And it came back with a vengeance, much bigger than it was before. Really? And I said, oh, Lord, I'm so sorry. And I started my vegetarian diet again, my exercise and everything. And I juiced, and it disappeared again. So to me, it's not coincidence, you know. It's when you work on it, your body will take care of you. So fibroids is not really that hard to care for. It's just you just make up your mind that you work on it.
Okay, so the healthy diet is really what made the difference for you.
Very important.
And going back to the less healthy diet made it come back with such a vengeance, very aggressive growth.
Yes.
Because perhaps increased estrogen in your body as a result of the chicken and processed foods. So let's really hit on the diet. This is the key point for everybody who's struggling with fibroids, especially painful ones. What is the optimal diet? We're talking plant-based, vegetarian, lots of green vegetables. Anything specific besides that?
You have to be really, you know, when you hit the problem, you have to know the reason why. So there are 2 things that you have to take into serious consideration. How to bring your estrogen to balance, back into balance. Your estrogen is going wild. So you have to take that into consideration. Or how are you supposed to eliminate the extra estrogen that you have, which you can do using diet. Okay? So you cut down on your fats so that you don't have extra fats. You eat a lot of grains, which has a lot of fiber, which has a lot of the right kinds of carbohydrates. Your vegetables with magnesium, with calcium, with manganese, and all the rest of the other minerals that are important for your liver and your ovaries and your adrenals to be able to work the best way they could to bring back your hormones to normal and also to eliminate the extra estrogen that you have in your body. So it's hit this, your ovaries, your adrenals, and your liver. These are the three important organs you have to care for with your diet in order to help shrink the fibroids you have.
And so what you're saying is that the animal-based diet, which is the typical American diet, the standard diet, is actually feeding the fibroids.
It is, yes, they are feeding them.
And the processed foods, I mean, even if I take vegetables from a can, that's not going to give me the benefit as taking it fresh. It needs to be fresh. The grains need to be the whole grains, the whole grain rice, the whole grain pasta, and so on. Now, is there any other way we can increase this expulsion of estrogen besides the diet? For example, exercise. What does that do?
Everything has to do, you know, by walking after eating, you enhance all your digestive organs, inducing your liver to do its work. Oh, very important. At nighttime, when you go to bed, it's about the time when your liver is starting to wrap up everything that you put in your body the whole day, okay? So you have to take care not to give extra food to your liver at night, so that instead of it's working to work on the food you gave it, it will work on detoxifying and cleaning your body of the extra whatever you have put in your body throughout the day. So a light supper would be friendly to your liver and would help eliminate your extra estrogen.
Now, you mentioned that you did juicing. Could you tell us a little more about that, what you juiced and where you got those vegetables from?
Oh, I used organic.
Only organic?
Organic, because when you do organic juicing, you concentrate all the nutrients you have there. If there was pesticide, you concentrate it as well, and then you drink that.
Right.
So as much as possible, get your certified organic juice. Fruit juice in the morning, different kinds of fruit and vegetables, not always the same vegetables from day to day, not always the same fruit from day to day, because you'll get tired of drinking this thing. Three vegetables today, another tomorrow, another, you know, so you don't fatigue.
Okay, sounds good. And so your appetite is still satisfied while you're treating yourself.
But not only juicing, okay, you eat a balanced diet and you juice on top of it, because you get the real nutrients you need, the vitamins and the minerals.
Okay, absolutely. And hydrotherapy, I know, can be very helpful for abdominal pelvic pain.
Yes, especially prior to the menses. You could do, again, the cold sits for 15 seconds. Okay, I want to make it sure it's seconds, not you would freeze your it's ice cold. 15 seconds of cold sits. It shrinks the blood vessels towards your uterus, so that it deprives the fibroid of blood supply.
Could we just sit in a cold bathtub, or does it need to be a tub that just isolates the pelvic area as we sit in it?
You could. It's actually as long as you have this area covered. But if it were 15 seconds of ice cold, you wouldn't want your whole body in the tub. You know, that's why you have a tub.
Okay, as long as you cover up to the navel and down to the upper thighs.
Yes.
Okay, wonderful. And then after that, that's it. You just do that just prior to menses?
Prior to menses, about a week before, every day.
Obviously, that's going to be the best, the natural approach. There's no side effects from any medications.
No side effects, sure.
But is there any medical approach that sometimes needs to be resorted to, perhaps?
Oh, the medical comes in, you know, it's hormones. They give you hormones, and many really opt not to take hormones. And the only complete management for fibroids is surgery. And not everybody wants to go through under the knife, you know. And besides, a lot of operations sometimes are uncalled for. But it happens. It happens that you have surgeries. It's because it's the easiest way, it's the quickest way, but not necessarily the best way.
And sometimes even a hysterectomy, the complete removal of the uterus, takes place. Would there be any recommendation you would have about that and maintaining the ovaries, or?
Yes, before, even in the medical practice, you know, in gynecological practice, they said it used to be when you turn 40, you get uterus, you get ovaries, okay? So when you take out the uterus, you have to take out the ovaries at 40. But then it moved up, you know, women caught up and saying, I don't want to menopause so early, surgical menopause so early. So then now we're giving this informed consent to the patients whether they choose to have their ovaries still or have their ovaries taken out. You can have an informed consent so that you know how to deal. You don't necessarily have to take your ovaries out.
And keeping the ovaries, of course, is ideal because then you can have the hormones still being produced.
You still have your hormones.
Now, Dr. Sheridan, you've been practicing for many years in the Philippines. You have many different experiences that have been very fascinating in my conversations with you. I've enjoyed it very much. Please tell us some of your experiences with fibroids to give our viewers hope if they're suffering with this.
Okay, I'll bring you closer. See, you might say, that's too far in the Philippines. I'll bring you one closer here to us in the United States. 2 years ago, after I had given my talk on fibroids in Wildwood during the Natural Remedy Seminar, a lady came to me and had said that she had fibroids and she also had an ovarian mass. And that was in June, 2 years ago. She came to me and she said that she was scheduled for operation on September. September. She was supposed to have her operation in September. And she said, can I do something about this because I have fibroids? I said, how big are your fibroids? She said, they're less than 6 centimeters. You know, you have prognosis much better if your fibroids are less than 6 centimeters. She said they were less than 6 centimeters. So I said, you have to exercise, you know, you have to eat properly, as in seriously eat properly, change your diet radically, do juicing, exercise, sleep early, you know, be temperate, open your windows, have the best air that you can have in your house, and all the natural remedies. I told her, you know what, she was doing this really, really religiously. In August, she went back to her doctor for all the final tests to prepare her for her September operation. Her doctor was on her for a long time trying to look for these fibroids. They weren't there anymore.
Wonderful.
And that was only 2 months, July and August.
Really?
September, no more. She's been clear since.
That's really amazing. So what you're saying is it really works.
It works.
You've proven it, and that's just
over
one of
and
many.
over.
Over and over. Praise God. So what special word would you give to some of our ladies that may be wanting to get pregnant but are having problems with fibroids? Would you recommend that they just go ahead and try to conceive, or that they should deal with the fibroids first?
I think they should deal with the fibroids first. Fibroids can compete with the pregnancy, you know, and it can affect the outcome of your pregnancy. You're already trying to get pregnant, and when you get pregnant and you lose your baby because of the fibroid, that's going to be hard, you know? So if you can just deal with one problem at a time, that's probably wiser. Deal with one problem at a time. If you cannot really deal with it, your clock is clicking, ticking down, and time is just so short, well, maybe you could try. But I'd rather just have one problem at a time. It gives you better, you know, coping.
Better management.
With that, yes.
And for the ladies that do opt for surgery or that need to have surgery, what kind of post-operative care would you add in addition to the lifestyle measures you've told us?
Oh, if ever you really decide to be operated on, and there's no other way, because there is always a place for surgery. It's not that we're saying, no, don't go to your doctor for surgery, that's wrong. Don't get me wrong, that is not the case. There are really times when you do need to operate on your patient. But surgery for fibroids is not an emergency. So if it is a big fibroid, you have to take care of your... Surgery is not easy. Post-operative recovery is not easy. I went through the knife twice. And it's a painful thing, not only physically, but even emotionally. And so she has to take care of her body to really be healthy so that she can bounce back fast, you know? And when you're operated on, as soon as you are given the permission to walk, if you can run, run. I mean, activity right after operation makes your intestines move faster, your recovery will be faster, your voiding will be faster, your bowels will start working faster. All in all, you will have a better recovery, a better chance of not developing complications from the operation. And then don't slack off.
Now that's the key, right?
Don't slack off.
Whenever we get any breakthrough, it's so tempting to think, well, let me just try like yourself. Let me just have a bit of chicken or a little bit of cheese.
But it is so human to do that.
But the body is so sensitive, it will respond right away.
Exactly.
And God has given us the promise that I'd like to share with our viewers in Deuteronomy chapter 7 and verse 12 and 13. It says that if you diligently hearken, so consistently hearken to these principles, then the Lord will bless you and multiply you and bless the fruit of your womb. And so we can take that promise if we know that we are following all the good lifestyle advice that you've given us today.
Yes.
Thank you so much. Are there any other testimonies that you can inspire us with today? Fibroids that seemed life-threatening perhaps to a mother or baby?
Yeah, for fibroids that are life-threatening to the mom and the baby, I've had several, you know, and it is something that you wouldn't want to experience. That's why I'm saying when you are dealing with fibroids and you want the baby, deal with one problem first, because it is difficult to go through it. It's like a horror thing for the doctor to have a patient with a fibroid that's going into necrosis and a precious baby in the womb.
Oh yeah, absolutely.
You really wouldn't want that. So, and operations recklessly done. I mean, so I would say maybe it would be really better to ask for the Lord to guide you to find a godly doctor to guide you through your pre-operation, your operation, and your post-operation. Because even if you keep your ovaries after the operation, sometimes when you take out the uterus, the ovary, what do you call this? When it sympathizes and it...
Really?
Yes, the atrophy of the ovaries after hysterectomy or just removal of the uterus alone, the ovaries also start to atrophy. It's like they were taken out. So that it's scary to do a hysterectomy. That's why the natural way is friendlier.
It's the best way.
It's so much friendlier. Yeah.
It's God's way, and His way has to be the most healthful with the least side effects, even if it takes a little bit longer than perhaps using surgery or medication. So to summarize about fibroids, basically we're talking healthy eating, healthy exercise, healthy living, healthy you, and the body should take care of the fibroids by itself.
That's true.
Thank you so much, Dr. Shirley, for being with us today.
It's a pleasure.
And for those of you at home that have been with us, we pray that the Lord will really bless you with this information and that you might be able to help many other people as well. And remember, the Lord made you wonderfully and fearfully, and He promised that He will take care of you as you cooperate with His health laws.